Does saturated fat clog your arteries? This is a deliberately provocative question because you can say yes or no and you'd be correct, because saying that saturated fat itself clogs the arteries is not true. However, making the claim that increasing your saturated fat intake can potentially lead to other mechanisms that then lead to clogging of the arteries is correct. This is an area that is rife with misinformation, misunderstanding, and it's an area that I also didn't understand in the past. Because early on in my career as a personal trainer, when I was advising people about nutrition, my understanding was that, look, it didn't really matter how much saturated fat you consumed once your overall diet was healthy, okay? Whatever that means. And I had a little bit of understanding of how to read research, but I didn't really have the skills that were required to decipher good from bad, so I was a little bit misled. Over time, that corrected itself. However, there are many people, cardiologists, people who write books about cholesterol and diet and heart disease, that will claim that saturated fat intake doesn't matter. They will also make the claim that high-fat, low-carb diets are actually what are best for heart disease. And even worse, they'll make the claim that LDL cholesterol does not actually cause cardiovascular disease, and that drugs like statins and other cholesterol lowering drugs are actually harmful rather than beneficial for cardiovascular disease risk. So very clearly, there are a lot of conflicting messages in this area. But today I want to focus on the saturated fat question. So the answer, first and foremost, is that yes, increasing your saturated fat intake, consuming a large amount of saturated fat, does increase risk of cardiovascular disease. Now, with me saying that, you've probably read in multiple areas that it actually doesn't matter, and I've read that. But why? Why is there that conflicting information? The reason for this, or at least a large part of the reason, is that nutrition science is a little bit different to some other, areas of study. So, for example, in medicine, if we're looking at the effects of a drug, the patient either takes the drug or they don't take the drug. And you can compare someone who takes the drug against someone who doesn't take the drug, and you assess the difference in outcomes. That's a very oversimplified description of how drugs are studied, but it's a basic understanding that's illustrative for today. When it comes to nutrition, everyone eats. Nobody really eats a zero saturated fat diet. So very often what we end up doing is comparing different populations. So looking at a population who consume, for example, a high amount of saturated fat and those that consume a low amount of saturated fat. And the ideal comparison here would be taking a population that consumes below the recommendation. So the general recommendation is to consume less than 10% of your calories as saturated fatty acids, even lower if you're at higher risk of cardiovascular disease, but less than 10% for the most part. So ideally, you'd want to compare a population that consume less than 10% to those that consume vastly more, for example, 20 to 30% of calories from saturated fat. If you compare those different levels of intake, you're going to see a significant effect. However, if you're taking populations in the modern day, where dietary saturated fat intake in a lot of populations has vastly decreased in the last few decades due to food reformulation and personal choice as well in terms of foods that are consumed. You might be looking at a difference of, for example, comparing a population that consumes 7% versus 11%, just as an example. And we've seen that in certain research studies. And when you look at these comparisons that aren't really that different and aren't actually in high versus low risk categories, you don't see much of a difference in cardiovascular disease risk. And this is one of the areas that a lot of confusion pops up. But overall, throughout the body of evidence as a whole, what we see is that saturated fat intake, when it's reduced, or conversely, when it's at a very high level, does definitely have an impact on cardiovascular disease risk. That does not mean it's the only dietary factor. There are other dietary factors. For example, fiber intake, the amount of trans-saturated fatty acids in the diet. That's a very important one, and it's one that's been largely removed from the food supply in a lot of developed countries. So there are other factors beyond just saturated fat intake that modify cardiovascular disease risk. But I think that one thing that's quite helpful to understand is that this relationship between saturated fat and cardiovascular disease does not just come out of nowhere. It's not like someone's just saying saturated fat clogs the arteries and we don't understand the mechanism. We do understand the mechanism. We know that when saturated fatty acids are consumed, for example, versus polyunsaturated fatty acids, we get an increase in the amount of LDL cholesterol. What this means is that we get a larger number of ApoB containing lipoproteins with cholesterol contained on them, okay, so they're proteins that carry the cholesterol, and that these particles in particular can be retained within the arterial wall, which then precipitates the development of arterial plaques or atherosclerosis. There are many different things that can modify cardiovascular risk. There are many different steps in the atherogenic process. However, the main thing to understand here is that this isn't random. It's not like someone is saying that saturated fat plays a role here for a reason that we don't understand. It is well understood. The more of these ApoB containing lipoproteins that we have in our blood, the greater the risk of developing atherosclerosis. Largely, we measure these ApoB containing lipoproteins by measuring LDL cholesterol. ApoB is probably a better, more accurate measurement. For the most part, in most cases, LDL cholesterol tends to be representative of risk. So, if you want to reduce your cardiovascular risk, you want to lower your LDL cholesterol. It seems to be the case that lower is better. It's not clear that there's a lower end to that benefit. For the most part, we see that the lower someone gets, the lower their cardiovascular disease risk. And similarly, if you want to increase your risk of cardiovascular disease, i.e., for example, dying from a heart attack, you would be best served to increase your saturated fat intake, consume lots of butter every day, put butter in your coffee, cook all your meals in butter, and that way you will be well on your way to a heart attack, okay? So no, please don't do that. Do understand that this area is messy. You know, if you're a lay person and you're trying to understand cardiovascular disease risk and you see doctors arguing about this and that and you see nutritionists arguing about this and that and it doesn't seem like there's any consensus, note that the vast majority of cardiologists, lipidologists, nutritionists, dietitians, etc. are in agreement that lowering your saturated fat intake, especially if it's high, is a good idea for cardiovascular disease risk. There's not as much disagreement as it would often seem that there is on the internet. There's mostly a consensus among the vast majority. And if you understand the evidential standards in science and medicine, it is very clear that LDL cholesterol and ApoB containing lipoproteins are very relevant for the development of cardiovascular disease, and it also seems that saturated fat intake has a very important role to play here on the dietary side. So hopefully you found this helpful. If you have any questions, drop them down below. I'll be more than happy to answer them. And if you follow up questions that you'd like me to discuss in another video, I'd also be happy to do that. Okay, thanks very much for watching, guys, and I'll see you soon.